For so many people, getting a diagnosis isn't the end of the road. In fact, it's just the start of a race against time, especially when the best treatment is thousands of miles away. Today, we're diving into a really critical gap in healthcare. What happens when the clock is ticking, but the journey to get treated gets stalled before it can even begin?
So, to really get a handle on this challenge, we're going to follow a personal story that puts it all into sharp focus. This is a story that is truly a race against time.
So let me introduce you to Dr. Mensah. She's a 36-year-old biomedical researcher from Accra, Ghana. She's this brilliant professional who's used to solving really complex medical puzzles. But in a wild turn of events, she suddenly finds herself on the other side of the equation, not as the expert, but as the patient.
And just like that, her desk isn't covered in research anymore. It's buried under this mountain of lab reports, scans, and referral notes. The diagnosis is a complex spinal condition, and the treatment she needs is a specialized surgery that's only available abroad. And with that news, the clock officially starts ticking.
And here's the thing, Amma's story, it's not one of a kind. It actually shines a light on a huge, hidden problem in the system, the often invisible but incredibly dangerous risk of just waiting.
So what's the biggest hurdle here? I mean, you'd think it's the surgery itself, right? The really complicated medical part? Well, not exactly. The real danger, it's the waiting. That period of time before anything even happens. Those weeks can feel like an eternity. And in medicine, that kind of delay can change absolutely everything for a patient's outcome. I mean, just look at the two different paths here. On one side, without any coordination, it's kind of chaotic, key tests might be missed, prep gets delayed, and specialists are basically starting from scratch when the patient finally arrives. But with coordination, it's a completely different ballgame. Diagnostics are flagged early, risks are assessed way ahead of time, and the whole team is on the same page before anyone even thinks about booking a flight. The difference is just night and day.
And listen, this isn't just a few isolated stories. We're talking about a global issue. Even the World Health Organization points this out, saying that these delays are a major reason for poor health outcomes all over the world. So this is a systemic problem, not just a personal one.
Okay, so what if we could just completely flip that timeline on its head? That very question leads us to a whole new approach, providing care before the journey.
This right here, this is the game changer. It's where technology steps in to fill that massive, stressful gap between getting a diagnosis and actually starting treatment.
So how does this virtual care network actually work? Well, it's pretty incredible. First, from her home in Ghana, Amma uploads all her medical records, scans, labs, notes, the whole shebang. Then she gets these super helpful AI-supported summaries so she can actually understand what's going on. And here's the kicker. She gets to consult directly with her international specialist before she ever books a flight. The care starts immediately.
And that first call, that's just the beginning. This is all about taking that intimidating stack of medical data and turning it into an actual, clear plan to get the patient completely ready for treatment.
And you can see the benefits right away. Through the virtual care network, any extra tests that are needed get flagged early. The surgical team can assess all the risks well in advance, and the hospital can even start the scheduling process. The entire care team is aligned and ready before Amma even steps on a plane. The whole thing just flips the old, slow model on its head. But getting ready isn't just about tests and scans, right? There's also medication, and that's where something called smart prescriptions comes in. Pre-op meds get prescribed digitally, the system automatically flags any potential bad interactions, and maybe most importantly, her adherence is tracked in real time. This ensures she's in the best possible shape for her surgery.
So everything, and I mean everything, the scans, the consultations, the prescriptions, it all gets pulled together into what's called the health vault. So what does that mean? It means by the time Amma travels, her surgical team isn't playing catch-up. They have her complete history, a clear treatment plan, and they are fully informed and ready to go.
What we're looking at here is a whole new standard of care, really. It's one where technology makes sure a patient's precious time is spent on healing, not just waiting around.
So picture this. Amma finally gets on that plane to South Africa. Just think about how different this is. There are no more delays waiting for a doctor to review her case for the very first time. There's no repeating tests that have already been done. It's just go time. Pure execution of a plan that's already in motion.
And, okay, we've been following Amma's story, but you have to realize, this is so much bigger than just one person. It means treatment planning can kick off the second a diagnosis is made. It lets specialists from different countries work together seamlessly. And it makes sure patient records are finally complete and easy to access, which, let's be honest, is the foundation of safe and effective healthcare. You know, when you boil it all down, it comes to this simple, powerful truth. When those treatment windows are tight, getting prepared isn't just a nice to have, it's literally life-saving.
So it really makes you think, right? If we can start the care before the patient even travels, what other fundamental parts of healthcare are totally ready for a change? What's the next big thing?